Hi, my name is Nehal Desai, and in this review, I'm going to go over asthma as it relates to the one of the NAPLEX review topics. Um, so let's take a look. Um, as you can see here, these are some of the common topics that's covered in this area of respiratory diseases. Um, you can see some of the medications might overlap between like the asthma, the COPD. There might be some different medications than cystic fibrosis. Um, we'll talk about that in the later presentations. Um, Sleep apnea, smoking cessation. Um, some of these topics are very high yield topics, so recommend going over these in your own materials as well. Tuberculosis, you'll probably see some other types of medications here. Typically, these are like infectious disease topics mixed into it as well, like the pneumonia and the tuberculosis. Um, and so, and allergic rhinitis. Um, so let's take a look. So in this section, it's about asthma treatment. So you could see here ICS, which is a um, corticosteroids, inhaled corticosteroids. And you got the LABA, which is a long-acting beta agonist, SABA, which is a short-acting beta agonist. The difference between these is mainly the frequency in which they're used. So, like you could see the SABA, that's a very common class of medications like albuterol. Um, uh, Whenever like a patient's having trouble in breathing, all of a sudden they might just take albuterol and inhale maybe one or two puffs, during that time. So they would they won't use that as like a maintenance treatment. That would typically be something like LABA or inhaled corticosteroids. Um, so we'll take a look at more of those in detail later. I'm just going to show you the mechanisms right now. Leukotriene antagonists. You may have seen one of these medications dispensed at your pharmacy, like the Montelukast, um, or Singulair as the brand name. Um, that has its own mechanism. Um, and then you got theophylline. That's another medication. I haven't seen it so much dispensed to anybody, but it is an important drug, and it can help with especially asthma disease, preventing inflammation and improving the bronchodilation as well. So, and biologics, these are usually just injectable medications like omalizumab and that target specific um, antibodies. And so, just very quickly, I'm just going to talk about like the inhaled corticosteroids. Um, just like how hydrocortisone works in like the previous section, binds to glucocorticoid receptor, and then it goes inside the nucleus of the smooth muscle, um, and it will actually program the genes that control like the inflammation. So to prevent further inflammation from occurring and bronchoconstriction, it's going to bind to that glucocorticoid receptor and then program it so it doesn't, so it prevents further inflammation from occurring. And then the LABA mechanism and the SABA mechanism are the same thing. They will just bind to a beta 2 receptor. You can think of beta 2 as like um, two lungs. So, like, and LABA, in the name, it stands for long-acting beta agonist. So you can already tell that's just going to bind to a beta receptor and on the smooth muscle cell, and then that will just reduce the smooth muscle uh, contraction. And then same as LABA mechanism here, and then the leukotriene antagonist mechanism. So there's three common types of leukotrienes here. You can see montelukast and saferlukast. They basically work just about the same. They bind to one of the cysteine leukotrienes. They inhibit that. Um, so um, to block the effects of that leukotriene or one of the pro-inflammatory uh, enzymes. And then xylitol specifically blocks the 5-lipo-oxygenase, so it prevents the synthesis of the cysteine leukotrienes. So that's how this mechanism works here. So you might see a question on this, or you may not, but at least know the differences in the mechanism between xylitol and the other two drugs in this class of medication. And then the last one here is the theophylline mechanism. So inside the cell, no, the body normally produces PDE enzymes, which is the phosphodiesterase enzyme. And typically this one breaks down, this enzyme is used to break down the cyclic AMP. So to prevent the breakdown of cyclic AMP, this medication blocks the effects of PDE enzyme, so it doesn't do that, which would therefore increase the cyclic AMP and allow for more of a bronchodilation. So there's in the smooth muscle, so there will be more breathing there. That's pretty much it. These are just very basic concept mechanisms I just wanted to point out here. Well, actually, there is one more here too. The biologics mechanism. This is very similar to like pro-inflammatory enzymes, but these are, other ones that are like IgE or IL-5, IL-5 RX, RA, with alpha, which is the receptor alpha. And then you have the IL-4/13 or IL-4 and IL-13 enzyme, and then you have the TSLP. So each of these biologics target their particular type of allergic or allergic enzyme. So you can see here IgE, omalizumab, then mepolizumab, and racilizumab blocks the IL-5. Benralizumab blocks the IL-5R alpha, and then the dupilumab, which blocks the IL-4/13, and the TSLP, which is blocked by the tezepelumab. Some of these medications you have already seen, maybe dispensed one time or another in the pharmacy, like Dupixent, which is the dupilumab, You may have seen omalizumab as well. So I just want to point out a few things here, specific targets of these enzymes, so that you're aware of how these medications work. That's pretty much it.